Dr. Bagai, I'll begin with you. Well, Dr. Bagai, you've been down that road with us, especially me, when a number of COVID variants started wreaking havoc in and around the world, in India as well, at the beginning of 2020. What we have today is reminiscent, a reminder of what happened a few years ago. But the big question on every Indian's mind, Dr. Bagai, this is something that I also asked you over a WhatsApp message just a few minutes ago, is there something to worry about? And if not, then why do you think so?
Good evening everyone. So this is a breakaway of the Omicron major variant, and Omicron itself has broken away into BA.1, BA.2, BA.3. This particular sublineages which we are seeing in the Indian subcontinent and indeed Southeast Asia, China and Japan is a breakaway of what we call as BA.2.86. This major parent variant has then given rise to JN.1, which we are seeing in India. It has given rise to LF.7 we are seeing in India, and LP8.1.1 which we are seeing in India. In different parts of the world, we are seeing different substrains. Overall, as a capture view, these sublineages, subvariants have got a unique set of mutations, what we call as flip mutations. They are mirror images of the previous ancestral strain. They have lost the infectivity, but as a trade-off, it has increased in transmissibility. So very quickly, just let me explain this. It latches onto your body mucosa, it's your upper respiratory tract, but not the lower respiratory tract. Therefore, these sublineages are not going to give rise to that much amount of hypoxia, oxygen dependency, ICU admissions, fatality and death. But since it is more transmissible, person-to-person contact, it can keep spreading. So like we've said for the last 3 or 4 years, 5 years, more we test, more positivity we'll get. As far as the healthcare system is concerned in Delhi and vis-a-vis India, we are extremely well prepared. We've gone through this for the last 5 years. To ramp up the systems will take less than a day. But at the present moment, the clear message is there is no panic. The vaccine program of India, which we had in 2020 onwards, we have given more than 220 crore plus. That means more than 90-95% of the eligible population have been vaccinated twice, and more than half of the vulnerables have been given a booster. That has held us very good because not only the neutralizing antibodies were there, but we built a T-cell arm of immunity, so the population at large has built a good immunity. But these subvariants are extremely immune evasive. So they are called as the fittest variants. That means they slip the body immunity. But since the Indian vaccine program has been so good, we are in a reasonably good space of comfort, but not being complacent. Do we need a booster? The answer is clearly no, for 2 major reasons. At the present moment, it is not that lethal, which requires the vaccines. And the second point is, in the Indian subcontinent, we've used 2 vaccines. One is the Covishield and the other is the Covaxin. They are both adenovector-based platforms. At the present moment, internationally, we have sublineage-specific vaccines. So we have JN.1 and KP.2 vaccines. So the old vaccines will not work very well for the present sublineages. Therefore, no vaccine and no booster right now. Simple precautions, masking, especially during travel and summer holidays, keeping social distancing. If you have a cold and cough, isolate yourself for 5 days. If someone has a cold or cough, keep away from them. Avoid crowded places, poorly ventilated places. Do not self-medicate. No need of antibiotics, no need of any antivirals, which we were clamoring for during the Delta wave. And clearly, there should be no anxiety. Keep good nutrition, look after your pre-existing comorbidities if you have, and just keep calm.
Absolutely. Good advice. Dr. Chawla?